Physical inactivity and too much sedentary behaviour is having a major impact on health and well-being globally. Positive action is needed now to encourage people to become active. More people are living in cities, and by 2050, over 68% of the world's population will be living in urban areas. We can have a big impact on inactivity and well-being by targeting cities and putting the systems in place to help citizens to move more. Here in Liverpool, we have been carrying out physical activity research with and for local people for more than 25 years. Some of our early research was amongst the first to note worrying trends such as increases in childhood obesity and substantial falls in fitness, which are all linked to childhood and lifelong health and well-being. We worked closely with Liverpool City Council and the health organisations throughout the late 1990s and 2000s to make use of our research evidence. This meant that city officials could understand areas of need and where to best invest resources to help improve health and well-being and reduce health inequalities. In 2005, Liverpool launched its pioneering Active City strategy that brought together key partners in a strong collaboration to promote and support a physically active population. Liverpool John Moores University made a major contribution to this strategy. Specifically, the Physical Activity Exchange at LJMU worked with Liverpool City Council and the city's health, education, administrative, charity and research sectors to develop a unique way of working. Our research helped to underpin the strategy. For example, data from the SportsLinks Children's Health and Fitness Project helped to identify areas with low fitness and poor food intake, which allowed the targeting of resources to address these issues. Our research also helped to evaluate commissioned projects. For example, projects like the Active Play Early Years Physical Activity and Nutrition Programme. Together, we have created evidence, supported practice and informed funding and resource decisions across the city to improve health and make a difference to people's quality of life. Our work in the field of active cities is not just confined to Liverpool. Liverpool, this most global of cities, was recognised very soon after the 2005 Active City strategy by a number of international organisations. This inspired an international movement, Global Active Cities, whereby cities around the world can work towards becoming a certified global active city. At the start of the Active City initiative, Liverpool was the most inactive of the 8 core cities in England and has now progressed to being the 4th most active. Through working together, the key stakeholders in the city have accessed significant financial resources to support active city-related initiatives and utilise evidence-based practice to demonstrate the impact of these initiatives. Global Active City is a collaborative programme led by the Association for International Sport for All and Evalio, with support from the International Olympic Committee. And we are important partners in this programme. Staff from LJMU act as expert contributors in the development of certification standards, as well as providing bespoke support to cities aiming to become a certified global active city. The first certified global active cities were Liverpool, Buenos Aires, Lillehammer, Hamburg, Ljubljana, Richmond and Lausanne, with Graz and Friedrichstad the most recent additions to the GAC family. So right now, over 6 million citizens are living in certified global active cities. As word spreads and more people recognise the multiple benefits of an active and healthier lifestyle, many more cities globally are involved in the process and working towards their certification. These cities include Guatemala City, Bopara, Dakar, Istanbul, Calgary, Rawalpindi and Dublin. The cities involved currently represent 5 continents and over 47 million citizens, with whole countries, for example Ireland, now signing up multiple cities to the programme. The project is undoubtedly global and continues to go from strength to strength. What does it mean to be an active city? Well, it's more than just a title. It describes a city with the people, policies and infrastructure in place to help all citizens to become more active. The programme aims to leave no one behind and to address health inequalities by reaching those with the most health deprivation. In the short term, this can lead to increased budgets for physical activity, new jobs and employment opportunities, new infrastructure and facilities, and mass participation events such as World Walking Day, Take Back Your Streets, where a city centre is closed to traffic and it allows citizens to play and to walk and to cycle, and fun runs, for example. Longer-term impacts include increases in physical activity levels within the cities, which brings substantial benefits for health, well-being and the economy. Our role in this project is much more than that of Liverpool's reputation as a city of sport. We now have a growing group of cities sharing ideas and learning from each other, and it's inspiring to work with many different groups, municipalities, organisations, and people from around the world. We have worked closely with some cities to support specific aspects of Global Active City work. For example, representatives from Buenos Aires attended 2 workshops in Liverpool to help develop evidence-based practice and evaluation. This type of work helps us understand the needs of the cities we are working with, foster close collaborations, and evolve practice on the ground. It is important that we continue to learn how to help populations to engage in physical activity, especially when many cities around the world are recovering from the COVID-19 pandemic, dealing with a cost of living crisis, feeling the devastating effects of climate change, and experiencing huge health inequalities that may disproportionately impact some groups within society. Having an evidence-based system which says, look, we know this works, here is the evidence, and having newfound trust between city-based agencies, including local government, health, education, planning, community groups, puts us in a much more resilient position to create innovative solutions, maximise dwindling resources, and join forces to promote a movement of movement. Liverpool and Global Active Cities has put a model in place to help support populations across the world to become more active, from whatever starting point that might be. And we look forward to continuing to develop and learn in our city of Liverpool and with our global partners. We were delighted to host the inaugural Active Cities Conference in January 2023, where we were able to celebrate the work of the Global Active Cities programme with partners from the World Health Organization, the Association for International Sport for All, Evalio, and ourselves at JMU. We look forward to attending and hosting more events like this in the future.